thank you so much for coming to the launch of these Rethinking Mental Health Promotion resources. I'm so excited that the day is finally here and that we get to share, share these resources with everyone. My name is Charlotte Barber. I am the Gender and Mental Wellbeing Lead for WHISE. Before I get into any of the content, I would like to acknowledge that we are convening on unceded Aboriginal land, and I personally am presenting from the traditional lands of the Bunurong and Wurundjeri peoples. And we recognise Aboriginal and Torres Strait Islander continuing connection to the land, waters and culture, and acknowledge elders past and present, and that Australia was and always will be Aboriginal land. So just before I pass over to our wonderful CEO, just so you know what to expect for the next sort of 60, 75 minutes, you'll gain access to the resource, first of all, and then learn about why we embarked on this project, the purpose of the resource. You'll receive a walkthrough. I'll take you, through some of the resource. Through some of it. And then we will complete a really short sort of interactive activity in groups and have time to have a little bit of time to feedback, but that'll be quite short. So I would like to invite our CEO, Pip McMahon, to just open this event and just tell us, a little bit, give us kind of her perspective on the resource. And it's so wonderful to have you here today, Kit. Thank you.
Well, thank you so much, Charlotte, and thank you to you for your wonderful work in leading the journey to where we are now, and thank you to everyone for dialing in today. I too am coming from the Wurundjeri Wurrung lands on Naarm today, and pay my respects to the lands that you're on today as well. Look, I want to start by saying we are delighted to be the Women's Health Service in South East Metropolitan Melbourne, and from that experience, delighted to be able to launch and present today these resources that really represent, I think, which are some of the key roles of a regional women's health service. And that is to actually take the opportunity to look at where we can bring together the reality and the lived experience of women in our region. And so often those experiences are not in a silo, they're not in a box. There is often combined experiences and combined conditions of mental health and well-being that women face. And the resource being presented today, which is the gender transformative approach to mental health and well-being, seeks to do that. It seeks to illustrate how the lived experience of all women in our region actually can be responded to. The multiple intersecting forms of discrimination, oppression, the multiple different barriers that women experience, how health professionals, health services, agencies can actually walk into that, lean into that, and respond that with really good evidence and practice approaches to make sure the services and the programs and the policies that are being designed are really in keeping with that lived experience. For WHISE, we see our role as continuing to encourage and push forward in addressing intersectional discrimination and barriers that are very present to women's health and wellbeing. And we've heard that no more than recently with the consultations and discussions with women in our region because of the Victorian government's inquiry into women's pain. There is no doubt in my mind that for women, the pain experienced by mental illness, by mental pain, by things like grief, the trauma of family violence, the impact of not being able to exercise, the impact of poverty is absolutely compounding their disadvantage and how well they are able to achieve a sense of health for themselves, and even achieve a sense where they can work with a health system to find the care that they need. I think what stood out for me for these resources, and I hope you find them too, is just how they've turned that great thing called theory into practical practice. We see that as part of our role as well, as the translators and the brokers of theory into tangible steps that workers in our region who are very busy with their work lives, their personal lives, with the demands being put on them, who actually share a common vision that we do for a world that is well and equitable. We see our role in helping that work to actually happen. And the key way that we can make that happen is by translating such complex, often misunderstood ideas and theories like gender transformative practice into tangible practice and actions. So I am really looking forward to seeing how this resource, these concepts, these tactics, this practice is taken up in our region. This won't be the end of it. This launch will certainly be going out and using it ourselves and helping people implement it and make it part of their day-to-day work. I want to thank the whole team of Women's Health in the Southeast. I want to thank Zoe Francis and in particular Charlotte, who has led this work, who has thought deeply about how you translate gender transformative practice into something that is accessible and doable for everyone. And I think for me, this is a model about how we can actually work with intersecting forms of illness and ill health in our region and put it into a form that can be taken up by the many. So over to you, Charlotte. Thank you so much. And I'm really looking forward to seeing how this goes.
Thank you so much, Kit, for that wonderful introduction and for your support from the top for us to sort of start with sort of well, I'll take you through the journey of how we started this project, but just such great support to really nurturing us to be able to bring these resources to life. So I think it's really nice from the top with these conversations or with projects like this to know sort of how they started. So entering this role about 18 months ago, I had in my previous role, which I see a few colleagues here from my previous workplace, that's so kind that they came today, but I had designed peer-to-peer mental health training in a tertiary education setting. So sort of entered here and I thought, I think I know what I'll be doing. We'll just be focusing more so on women's mental health. But little did I know that this would be a journey that really permanently changed the way I personally actually looked at mental wellbeing. We'll discuss that a bit more later. So we started by considering how we might apply a gender lens to sort of mental health literacy programs. So if we were to, design, you may have heard of, say, programs such as mental health first aid, what would that look like with a gender transformative lens? So we actually started with a pilot, and some of the people that attended the pilot are here today. So again, thank you so much. This has really been such a sort of community-wide team effort to get to this point. So we started with a pilot that kind of looked at what are sort of some of the gender determinants of mental well-being? And this is sort of what I was meaning when you look at the slide. I took these screenshots from, I just sort of, started going through the news around, okay, what can I even find the links between sort of gender and mental health? And it was really easy because there's actually a lot when you sort of start to look at it. You can see here around, sort of, say, masculinities and stop telling men it's okay to cry, or the opposite, having a cup of concrete and hardening up. We see news headlines often about 1 in 2 Australian women facing a mental health issue, or sort of double burden of paid and unpaid labour, perimenopause, say, being a risky phase for developing eating disorders. So we really see those interlinks between sort of biological sort of determinants, like biological sex and gender determinants of health. We see, here, testosterone treatment boosting mental health of transgender and gender diverse people. It was really, once we started looking for this evidence, it just, there was so much there. So our pilot very much focused on exploring the gender determinants of mental well-being at more so the individual level for women of different life stages. So that was actually one of the activities in the pilot. Tell us what you think might influence the mental well-being, say, of young women. And we see there, I don't expect you to be able to read the whiteboard, but it has sort of factors such as identity, family pressures, service systems that very much sort of portray quite white ideologies, cultural expectations, not knowing where we want to take life. Then when we get to sort of middle-aged women, we see middle-aged women experiencing sort of being part of the sandwich generation, where they have sort of younger children to look after and also sort of older or, aging relatives, body and hormonal changes, inflexible working arrangements, and then around sort of older women and feelings of isolation and grief and changed purpose and sort of increased invisibility as women get older as well. So we talked about a lot of these factors. And after sort of running this pilot and getting feedback from the wonderful people who are willing to sort of go on this journey with us from the very nascent stages, when we realized, okay, what are some of the, say, barriers, for example, to help seeking, or what are some of these barriers to, say, women experiencing sort of better mental well-being, we realized a lot of these barriers are systemic. So if we wanted these systems to change, we needed to pitch our project more so at the system, or the people who could address these levers at the community and systems level. And then this approach, combined with feedback from our sort of social and health planners in the region for more information on how they could involve other business units in more of a systems approach to mental health promotion, is how we landed on creating this resource. And at the top of this discussion, I very much want to thank the people who attended the pilot workshop and our health planners who have just provided incredibly useful feedback during the consultation period and demonstrated a real ongoing commitment to this work. So what is the, so what is the purpose of this resource? Well, as I prepare to, as my time comes to an end at WHISE, I almost see this document as a bit of a public handover of sorts that really demonstrates where we are currently at with understanding how we can place a gender lens over mental health promotion. So, mental health promotion, gender transformative practice, intersectionality, these are all, very big words, but, behind these words, they're complex themes. And the idea really was to combine them in very practical terms grounded in evidence. So the resource, this Rethinking Mental Health Promotion resource, which I promise I'll give you access to in a moment, but it's designed for health planners to, or, health planning. So it's around sort of facilitating, it's designed to facilitate links between public health priorities and mental well-being, all with a biological sex and or gender lens. So it very much is a sex and gender-based health equity resource, which will, describe how biological sex and or gender impact well-being broadly. And it very much assumes that the mind and body operate in unison, and that promoting physical well-being supports mental well-being. And it will also demonstrate, as Kit alluded to, in very practical terms, how gender transformative solutions, which actively challenge gender norms and address the root causes of inequities, such as, gender power dynamics and differential access to resources, can achieve equitable outcomes for people of all genders. So I also think it's really important from the top to talk about intersectionality and the use of binary language in the resource. So intersectionality is a term coined by scholar Kimberly Crenshaw. And if you're not familiar with it yet, it refers to the ways in which different aspects of a person's identity and expose them to overlapping forms of discrimination and marginalization. So in other words, not all women have the same experience of gender inequality, and people experience it to varying degrees. And in reading this resource, we really encourage you to consider how sexism and genderism intersect with oppressions such as, but definitely not limited to, racism, homophobia, transphobia, ableism, colonialism, and sizeism. So, WHISE, as a women's health organization, our sort of key knowledge area has often typically sat in that gender intersection, but to us, intersectionality is more so a lens that we really aim to apply to all of our work. But I think it would be remiss to sort of claim this as an intersectional document when this is very much the beginning, and the idea of this being a living document is that we actually collaborate with people and organizations with lived experience of other oppressions to make sure that this document kind of comes to life. And the idea is that it's very much led by actually asking questions and getting to know the groups that we're working with, and not sort of just assuming that we know what people want. That sits sort of at the forefront of this resource. So it's really good when you're reading this, absolutely apply that critical lens of, do you think this would work with the people that you typically work with, or in what instances might it not, or, who might this actually be really helpful for? And often that's thinking, which we'll get to, but, who has the power in the given situation, and how might we be able to redistribute some of that power? In terms of binary language, we do endeavour to be inclusive of all women's experiences, but some of the information presented may not reflect all the experiences of trans and gender diverse folks who have been historically marginalised and excluded from gendered research around mental health. Our language may at times reflect some of this historical binary language around sex and gender, but we'll move between the two using terms such as sex assigned at birth. So, for example, assigned male at birth or assigned female at birth, and more gendered language. So let's get to this resource walkthrough. So you can scan the QR code, but I'll also put a link. I'll put a link in the chat as well here. So this should take you to our website, and you'll be able to sort of input your details and then download the resource. And I might just actually give everyone a couple of minutes to do that, because the idea now is that I'll take you through some of the core concepts.
Did you say you popped it in the chat, Charlotte?
Yes. Did it come through?
No, I haven't received
Oh,
anything.
okay. Oh, hold on. Thank you. I know why. I put it in the waiting room. That's not helpful.
That's better, thank you.
And I do want to say just such a huge thank you to Dos, who is our communications and design lead, who just made this resource just look so beautiful and really focused on making sure it was easy to navigate as well. So thank you so much, Dos. Thanks, Laura. Okay, so what I'm going to do is answer sort of these key questions while we're sort of everyone's downloading it. So I think it's important. You might be wondering, okay, all good and well, this sounds great, but actually, why is a gender lens over mental well-being important? So where we've landed in the past sort of 18 months doing this work is that to truly promote mental well-being, we really need to consider it as a precondition to health in all areas. So this involves working at the community, societal, and systemic level to link the social determinants of health, such as education, socio-economic position, and housing. That's a few, to mental well-being. And then we know that one such determinant of health is gender. And we know that rigid gender norms can impact mental health in several ways. Before I keep talking, I'm just going to make sure, I've seen the lovely Gemma has just come in, so I'm just going to make sure that everyone can get access to the resource. So yeah, we know rigid gender norms can impact mental health in several ways. Just, in very concise terms, we know from the fantastic work of the Men's Project that, men constrained by the rules of harmful masculine stereotypes take part in risky drinking, are more likely to be in incidents such as car accidents, and perpetrate sexual harassment. And they also report poorer levels of mental health. For women, we know that gender, biological sex and gender significantly impacts the mental health of women through, inequality, discrimination, harassment. We've already talked a little bit about the double burden of paid work and unpaid caregiving. This is being highlighted very much this year with the Senate inquiry into women's pain, but the gender pain gap, resulting in mental health concerns often being minimized or dismissed, leading to inadequate care. And then for trans and gender diverse people, often can report significant experiences of stigma and discrimination. And this is very much, notwithstanding the capacity of trans and gender diverse people to absolutely thrive. Poor mental health outcomes and high suicidality have also been identified for those who have experienced abuse. So a gender transformative approach is really crucial for addressing these key levers around, and improving mental wellbeing outcomes, because it aims to address the root causes of gender inequalities and intersectional disadvantage and their impacts on mental health. So gender transformative practice. The simplest way I can put it is that it is very much a lens. It's not a checkbox, it's not a prescriptive set of actions. It is a lens that seeks to challenge the causes of gender inequality and intersectional disadvantage and support gender equality. And it's a way of working and conceptualizing issues. You can see here from the spectrum, I think it's a really good way to describe it, that approaches may either exploit, accommodate in the middle, or transform gender norms, practices, and structures. And you can see that presented visually here. So I'm going to use the example of active living throughout the rest of this presentation, just to ground the work in a few examples. So a gender unequal initiative or sort of policy perpetuates inequities. And let's say, a gender unequal approach to promoting exercise among women would be something like an 8-week bikini body weight loss challenge. So the focus on, achieving a bikini body is often rooted in societal expectations that can equate a woman's worth with their appearance, particular, say, body size and shape, and can perpetuate the idea that women should prioritize their looks, to fit a specific and often unrealistic standard. So, it's promoting active living, but in quite a gender unequal, sort of exploitative way. When we think about gender sensitive projects or policies work, they acknowledge gender norms and inequities, but they don't address the inequities. So this might be, say, an active living program that offers various fitness classes that, and there might be group fitness classes such as yoga, aerobics, recognizing that women might be more inclined to exercise in groups for more sort of safety or sort of social norms. And the project might try, the gym program might also schedule these classes at times that consider, say, a woman's potentially their typical caregiving responsibilities, such as scheduling the classes during school hours. However, the program doesn't really take steps to challenge or try and change the underlying gender norms that would dictate, say, women's roles in caregiving or their limited access to recreational time compared to men. So it definitely acknowledges the differences in participation, but doesn't actively seek to address or shift the systemic barriers that actually contribute to these inequities. And then when we think about a gender transformative program, which is really what we're trying to work towards in that lens again, these types of sort of initiatives aim to address the cause of gender inequity and includes ways to sort of transform harmful norms and relations. So let's take that same program again. They might, actively promote and normalize a wider range of activities for all genders. So they might say encourage men, to participate in something like, say, yoga or a dance class, and women to engage in strength training, more competitive sports. And they would, work to, say, dismantle in doing that, the stereotypes that might dictate what types of physical activities are appropriate for different genders. And instead of scheduling fitness classes at times that just assume that women are the primary caregivers, the program could offer a variety of class times to accommodate diverse schedules. It might even offer sort of childcare services and actually encourage men to take part in these responsibilities. And challenge the norm that caregiving is primarily a woman's role. Sporting programs that are working to be gender transformative might advocate for policies and infrastructure that support gender equity in physical activity, such as safe public spaces for exercise, equitable funding for sports programs, and say really addressing issues such as sort of say aggression in sporting or sort of gender-based violence that actually limit women and girls' ability to participate in physical activity. So we've talked a bit about like, what does it mean? Why is a gender lens over mental wellbeing important? What is gender transformative practice? What would then a gender lens, what would a gender transformative model of mental health promotion actually look like? Now, this model is probably the one I am the proudest of in this document, because I think it does combine quite a few sort of different concepts. It combines gender transformative practice very much at the top, levers to support mental wellbeing at the systems, community, and individual level, and then we have the alignment at the bottom. If we did all of these things, what can we expect to see in terms of the intended outcomes which align with the Victorian Public Health and Wellbeing Plan? So what I really like about this is that the factors are demonstrably, connected to mental well-being without being overly individualistic. And what you'll see in the full resource is that there's the page and then there's the explainer. So I won't go into too much detail, but for every single sort of lever at the systems, community, and individual level, you can read a bit more about what we're meaning by that. If you're going, okay, I can see how high quality green spaces, I can see how that might be useful, but what's the evidence? And hopefully by viewing this diagram, you can also see just how many people, if we're talking in council terms, how many sort of business units work in mental wellbeing. So, for example, parks and recreation, respectful relationships, maternal, family or child or family health services. I'm just trying to think if there's anything more I want to say on that. I think just one more thing I really like about it is that often I think we focus very much just on this layer of sort of the individual level of what can someone do at the individual level to support their mental well-being. But I think it's great to actually see a stepped approach of these sort of community and systems levers that are going to support mental health promotion with a gender lens. So then you'll see on the next page some core principles, 7 core principles of gender transformative practice. And I want to draw your attention to the bottom 2 around employing principles of feminist evaluation. So again, we said this approach is definitely grounded in evidence, and when we're evaluating programs, policies, initiatives that we're trying to apply this lens to, it's really important the evaluation aligns with that ethos. So yeah, UN Women have published an excellent resource on gender transformative evaluation, which describes the principles of feminist evaluation in further detail. It's a really great resource I wanted to draw your attention to. And then one that's a little bit closer to home and actually combines what I was talking about at the beginning around the importance of lived experience at the forefront of all of this work. I'm not sure if Danny McCaffrey is here, but the Promoting Respect and Equity Together, or PRET partnership, have put together an incredible lived experience framework that aims to, guide organizations and practitioners on how we can value and embed lived experience in very evidence-based and best practice ways. And it's a fantastic sort of companion guide when you're looking to embed lived experience into a program as a principle of gender transformative practice. Okay, we're running pretty well for time. So can I just confirm? So hopefully everyone has downloaded the resource by now. I'll just put it in the chat one more time because you will need the resource for this part. But what I'm going to do, I actually put these on the slide. So what I'd really like us to do for the next 5-10 minutes or so is have a think about how some of these, if you go to the page, I should know these off by heart, page 9 and 10, around sort of what could good practice design look like. Could is a very intentional verb because these are just, potential questions that you might like to consider. What we'd like to do is focus on that top blue box around sort of why are we doing this work, and you'll see there's a few key questions there that I'm hoping I put on there. Yeah, okay. So what I'd like us to do in very small groups, I'll probably put 3 or 4, is try and apply. Think about a project that you are working on or may work on in the future, and discuss in small groups what is the core health issue or issues that you are addressing, how might gender norms impact this issue, and then what would a positive shift in mental well-being look like for this project. Awesome. I think everyone's back now. Okay. Does anyone want to share? We'll open the floor in case anyone does want to sort of contribute what they were discussing. I hope I didn't cut any conversations short. We've just got a little bit more to get through before, and I think we'll be able to finish on the hour. But yeah, does anyone want to share?
I think Melody should share.
I'm happy to share what I just shared in the group. Charlotte, in the program that I have, designed at City of Casey, which is community seed funding, that undertakes all these questions.
Mm-hmm.
We started discussing, or we started understanding the priorities of the communities first, which were around gender-based violence, and which also covered migration issues, other barriers that they face, even including language. Like most of the people don't even speak English. That's like their third language, and they don't read and write their own community language. So there were a lot of those issues that came across. The problem was they were not even comfortable to share what they had to share. So it was about bringing them and giving them the safe space. The gender norms that is women, they can't talk if men are around. So we had to kind of understand that and bring that space, like, separate space for women, and then maybe having a mixed space where women are comfortable.
Yeah.
So when we were understanding the priorities, physical health issues, like, for women, it was endometriosis, PCOS, menstruation. There was mental health and less activity, like, not having enough opportunities or activities that they like to do, the physical, workout, whatever that looks like from their perspective. That came out as one of the things. Second thing was, for men, it was more around activities that they prefer or spaces that they prefer. And it was also around languages, like, or those men that I interacted with did not speak English. So they were looking for someone who can facilitate in their own language and then talk around the issues that they are facing. So these were few of the things. Now, positive shift to mental well-being started with education, because these people did not think that the issues that they were facing are mental health issues.
Mm,
Like they're not able to identify the signs and symptoms. Forget
Mhm.
talking about it because they feel if we disclose, first thing my community will say, oh, he's gone mad. He's in
Mhm.
Australia. Now what? Now he needs to be very happy. He can't be,
Mm,
talking about mental health now that he's here at a better place. So there are a lot of these assumptions, biases that are at place, which stop people from discussing mental health. So
Yeah.
for me, in this program, it was starting with that basic education about
Yeah.
mental health. So
Yeah.
I can go on and on. Like there are so many other things that came across as far as mental health, well-being, promotion is concerned.
Mm,
But I would like to point out that it started with really basic, even educating them that there is a mental health well-being plan with the GP, which is free
Yeah.
and is not, chargeable. So,
Yeah.
and then you have to identify and go and talk to the GP. So articulating what they're going through was again a problem. So
Mhm.
there are a lot
Yeah.
of small baby steps to even reach where we want to
Yeah.
reach. What I want to
Absolutely.
disclose. Thank you.
Thank you so much, Malavika, for sharing that. Yeah, really, really appreciate it. In the last sort of 12 minutes, and it sounds like a fantastic program, by the way. In the last 12 minutes, what I'd like us to do is I'm just going to walk you through sort of the rest of the I guess, second half of the resource. So, and not in detail, but really just to say that we, for this resource, took the 4 health priority areas that are based on the Southeast Public Health Unit Population Health Catchment Plan for 2023 to 2028. And we thought about what a gender transformative approach to mental health promotion could look like in these areas. So these priorities were based on a comprehensive needs assessment and analysis of population health data, looking at demographics and modifiable risk factors associated with preventable chronic disease. And we also chose to focus on them because, as you'll see, reducing vaping and tobacco use and related harms, preventing hospital admissions due to falls, improving cervical screening and HPV vaccination, and improving active living, that required us to think quite laterally about how we could sort of promote mental well-being within those priority areas. So what you'll see, just to take, say, what I might do is just share this here. So hopefully, oh no. Can you see can someone just nod if you could? Hey, great. So you'll be able to see here for each of the priorities, sort of say 3 key points of evidence that link the priority area to gender, and then using sort of the socio-ecological model of health that says we can affect change at the individual, interpersonal, organizational, societal level. What could that change look like? And then what would the expected mental sort of health outcomes be from that? And then where we got even more practical is, just for active living again here, what examples of this sort of work look like? And then what would the medium and long-term sort of expected outcomes be? So the idea of that is you can see, how this lens can be applied to a range of priority areas, and the idea really is to apply it to priority areas that we sort of improve mental well-being. It's almost a co-benefit. So yeah, it's very possible to think, okay, in active living, for example, just to point out one piece of evidence, active living is often framed as sort of diet and weight loss activities. Dieting, we know, can pose sort of significant psychological risks with very negative consequences, and we know it's one of the strongest risk factors for developing an eating disorder in women, which is a reported sort of mental health concerns. We see there quite a clear link between active living and mental well-being. And then, okay, what would we, be able to actually do? Well, say, for example, here, shifting public health campaign messaging from, say, weight loss and diet culture to promoting mental health and overall well-being through physical activity. Yeah. So I just want to go back to my here. So just sort of in wrapping up, very much the call to action is, please download the resource and share that link widely. The link, the website link, to get other people to download it. So whoever you think could really benefit from having a read or might be interested. We will be posting this recording up on the website as well. And you'll also see when you download it, there is the sort of full document, and then there's the high level summary as well, which is only 3 pages. This is very much, as Kit said at the beginning, just the start of disseminating the resource and working. We will be working with the Southeast Public Health Unit, because we did, for this project, we used sort of the 4 priorities in the Southeast Metropolitan Region. So we'll be working with their sort of implementation groups, and be taking this work out and trying to get some really good runs on the board with what does this look like in practice, and taking it sort of out of the resource. Yes, Jody. So please email me if you think, oh, this would be great for our organisation to come and do an introduction of the resource and share it and run a few activities. Please send me an email. We'd absolutely, that's sort of the next part, is actually getting out there and working sort of at the more sort of community level of how might we apply this lens, and hopefully in a year's time we can have built up some great examples of practical work in the field to and then what I would really like us to do, actually, before I do that, I will just ask if anyone has any questions. But what I would really like us to do in the last couple of minutes is, I have an anonymous Slido. I would just really like to know, I think the question is on there, but based on what you've learnt about the resource from this launch, what is one action that you could take based on today? I'd love to hear what that is. And if you've got any questions whilst we're doing this, please just ask. Promoting the resource local governments in the region. Finding ways to implement in the best way possible. Examples are helpful to make the ideas tangible. Carefully consider how issues are framed. Absolutely. So much of this work is in the framing of issues. Reviewing where we as an organisation sit on the continuum. Excellent. Implementing projects through a gender transformative lens, using it as a planning tool. These are, excellent. Creating multi-layered campaign that incorporates a greater gender lens. Promoting resource through Eastern Health Mental Health Program, Gender Equity Committee Equally Well Committee, credible sharing within team. Awesome. Oh, this is so exciting. Thank you so much for sharing those. Thanks, Bev. And as I said, in response to Jodie's question, please reach out. My email is, you probably would have received it in event comms, but cbarber@wise.org.au. If you think this is, we'd love to sort of, we will, come and sort of deliver this presentation or a version of it. We can absolutely work with you to make sure it's relevant, but please share the link widely, and I really appreciate you coming to this launch and supporting this work. So that brings us to 11 a.m. Thank you very much. Thank you to all my wonderful WISE colleagues for coming to support as well. And yes, absolutely. Send me emails. I look forward to chatting with you soon. Have a great rest of your Tuesday.